Hello everyone. Today we are going to see about Braxton Hicks contraction. So what is a Braxton Hicks contraction? Braxton Hicks contraction are also known as false labor pains. So what is a false labor pain? False labor pain is nothing but the patient will have abdominal cramps, but it will not lead to true labor. Say for example, the uterus will be producing cramps just similar to the uterine cramps, just similar as it happens in true labor, but not with the intention to cause the labor. Fine. So it is just like a practice session for the uterus. So how will we differentiate? But whereas true labor, it will have uterine contractions, so that it will result in the delivery of the baby. Fine. So these are the two different Braxton Hicks contraction and true labor. Now, how do we differentiate false labor versus true labor? In a young mother or a new mother or even multiparents, they might get anxious about the false labor, right? So in that case, there are certain techniques by which we can decide. First one is false labor pains, they will not increase in intensity. But on the other hand, true labor pain will increase with intensity. So that means the true labor pain, with the time, the intensity of the pain will increase. But whereas the Braxton Hicks contraction or false labor pain, there will be no change in the intensity at all. Similarly, true labor pains, if you see, if there is a change in position or if there is a change in activity or whatever activity you are doing, so all that will not affect the pains. But whereas in false labor pain, if you change position or if you do some other activity, the cramps or the pain will subside. Another thing to note down is three most important things in case of true labor pain. Whenever the mother feels that it might be a true labor pain, then in that case we need to do three things. One is nothing but is the intensity, which I have told. We have to note down the intensity, whether the intensity increases or not. And second one is the frequency. They have to note down what is the interval with which the pain happens. Say for example, the pain is starting now. So at this moment when it starts, there is a pain once in every 40 minutes. But with the time, after about 2 or 3 hours, the pain is beginning to come with increased frequency. Like it will happen once in 30 minutes, or another, then once in 20 minutes, then once in 10 minutes. Then so that's how it happens. So if it is true labor pain, it will increase in intensity, it will increase in frequency, and it will last long. Like for initially, if they note down the time for which the pain starts, maybe it will last for about 10 seconds or 20 seconds. But with the time, it will keep progressing such that the time for which the pain is present, that will last for a long time. So whether first it will be for 10 seconds, then after around 2 or 3 hours, it will be for about like that. It will keep increasing. That intensity for the time interval for which the pain lasts, that time interval will increase. So this is the three main things. So if you are a mother and if you want to know how to differentiate, the best thing that I would advise is take a note. Whenever you have a pain, you have to note down the time at which, say for an example, morning 10 a.m., right at 10 a.m. and whenever that cramps happens, and after that note down with a stop clock, like for how many seconds you will be having that pain. Third, then note down, then after what is the interval that the next thing. So say for example, the next pain starts at around 11 a.m. So again you note down 11, then what is the intensity, then also note down the intensity. So in this way we can find out, then do any activities. So note down whether the pain still persists or it's gone. So in this way you can differentiate whether it is a true labor pain or else it's a Braxton Hicks or false labor pain. Another one is, if it is a true labor pain, it might be associated with bloody show, or else it might also be associated with rupture of membranes. Anything can happen. So that also we need to be careful about. Thank you. Have a good day.